here today to deliver a really important letter to President Biden, and we are telling him to leave Medicare alone, make it better, make it stronger. Do not privatize our health care. And we are going to be delivering a letter that was signed by over 19 retiree organizations, and you'll hear more about that.
When we try to get in, if you're here, it would be great for you to come with us.
Who is she?
Okay.
Oh.
But she's the regional administrator. I think I mentioned there are like 10 regions of the Center for Medicare Services.
We are here today because as the national, we are all CROC members. We've been working for the last 3 years to fight against the city's plan to switch us into a Medicare Advantage plan. And we have also created a national alliance of retiree organizations nationwide. And the letter that we are delivering today to the office of the CMS office and also to President Biden was written by the National Alliance, and we are against the privatization of Medicare, we are against Medicare Advantage, and we are for the expansion of our Medicare benefits. So that's why we are here, to make sure that the President and the CMS and the HHS President know that privatizing our Medicare is a very bad idea.
And I want to throw in that 19 retiree organizations from across the country have signed on to the letter.
Medicare Advantage is alive! They don't care if seniors die! Medicare Advantage is alive! They don't care if seniors die!
These insurance companies are all accused of fraud. 8 out of the 10 of the biggest Medicare Advantage companies in the United States have been accused of inflating their claims. 4 of 5 of the biggest have been accused by federal lawsuits. Why don't they have dental? Why don't they have optical? Why don't they? We can take the money from the fraud and put it in and make Medicare whole. That's why we're here. That's why we're going up and delivering a letter to President Biden saying, this is what you can do. Thank you. Yeah. These are the organizations from all over the country: Vermont, California, Minnesota, Delaware, who agree with us that Medicare Advantage is killing seniors, and we need to have the Medicare, the original Medicare that we know and love. And everybody all over the country is getting this, and we want to make sure that the President and the Center for Medicare and Medicaid Services knows that this is happening.
There.
In the press release too, right?
As Gloria said, I'm a retired librarian with New York Public Library, and you may have seen me at the reference desk for over 20 years. So now I'm retired with disability. I have both a hearing and vision loss. This condition is progressive and gets worse slowly over time. So while I was working, I had a moderate hearing loss and was able to see at the desk. However, my hearing began to get worse, and it became harder and harder for me to hear. I became a candidate for a cochlear implant, and I had a cochlear implant, and it was successful. It restored my hearing. However, because of my vision loss, I could not determine direction of sound, and I needed a second cochlear implant. Together with my doctor, who was the head of NYU Medical Center, we scheduled the surgery. I was all set, and what should happen, but the night before my surgery, I received a phone call my surgery was canceled. This could not be. How could this happen? My doctor told me it was canceled by Aetna Insurance, a managed insurance company. They said my surgery was experimental, and they were using data from over 20 years ago to back their claim. Very false data, not true today. It was a successful surgery for many people. Anyway, my doctor and I had to appeal my surgery. This is what happens when people are denied. What do you do next? You have to appeal. First, you appeal to the insurance company. But this insurance company fought every step of the way. It took months. I had to appeal all the way to the New York State Insurance Commission, where 3 doctors ruled that the surgery was indeed necessary, and I was able to get the surgery. Yay! Not everyone will get all the help that I received to fight their appeal, and they may give up and not get the medical care that they need, or they may get it too late. It's not fair that insurance companies do this to retirees. These surgeries are covered by Medicare. So why are they denying people care that is provided by Medicare? They're doing this to make money. That's why, and we've got to stop it right now. Yes.
Yes. Bring a letter in to
Take the letter.
Human right. Fight. Healthcare is a human right. Fight. Healthcare is a human right.
That's a disappointment because so if I just walked here and we're citizens of the United States, and if I just walked here and walked in, you would let me. But because these people are here, you're not going to let us in.
No, this is up to FPS. If FPS says that you just have to mail it, that's it.
Who is
FPS is in charge of the building security.
Oh, are they here? Can we talk to them? So can we talk to the head of security?
If you want to go to the mailbox and mail it, that's up to you. Only one person will be allowed to go do that.
Oh, go in the mailbox inside?
The post office and mail it.
Wait, in here?
Inside the building.
Yeah, but we don't have the stamp on there. We were going to deliver it in person.
Nope.
And
Why not, sir?
Who makes that decision?
Excuse me?
Why not? They're public, aren't they? Isn't this a public building?
For the most part, is it a public building? But if FPS basically says what they want to do as far as protesters being outside, it's the options.
But it's
we're
not a protest
protesting.
at this
We're
point.
delivering a letter.
But you have more than one person.
No, it's going to be
No.
just one of us will go in.
One of us.
As a matter of
Just one of
fact, I did speak with you last week. I was allowed inside. They told me I asked for a room, and it turned out it was a DOJ because they didn't have it listed, the CMS, but we now know where it is, and it means just going up to the room and bringing the letter there.
It's not going in the room. They will allow you up there now.
Who's they?
FPS, they explain that to you.
FPS. So why can't we talk to the person who's in charge?
If you want to talk to them, that's up to you.
Yeah. Well, can we go in?
Yeah, we were trying to make an appointment because we kept calling and they didn't answer the phone. We wanted to make an appointment. We wanted to find out about the room.
Come on, let's
And
just
which
walk
room
in.
is this? I'm sorry.
It's on the 18th floor.
And who is that?
It's the Center for Medicare and Medicaid.
I see, right.
Yeah, the
That's
regional
why we're here.
director has an office
Okay.
here.
So insurance companies make the decision about the health of retirees. So that means that insurance companies who are in the business of making money are trying to they deny and they delay health care, and as a result, retirees don't receive the health care they deserve. Medicare, on the other hand, does not do that. So now what's going on, also because Medicare Advantage sells itself, you see the ads on TV, they call themselves Medicare Advantage. It's not Medicare, it's privatized health care. And they make promises. So now people that aren't even in unions or organizations where they receive health care benefits, Medicare benefits, individuals are buying Medicare Advantage plans thinking that they're better than Medicare because of false advertising. This is fraud.
ComRo has been in existence since 1995, always protecting benefits, in particular Social Security and Medicare. Through the years, we always thought that the enemy was the Republicans, who were against Social Security, and like Barry Goldwater and Ronald Reagan against Medicare. And then we woke up in the 21st century, and we have Democrats and Republicans who are foisting Medicare Advantage on us. More than half the people in this country who are on Medicare are now on Medicare Advantage. They have lost their Medicare. They're on Medicare Advantage. And why? Because of Medigap. Because they had to pay for their Medigap insurance, unlike city employees. It was cheaper for them to say, you know what, I'll give my Part B to an insurance company and they'll take care of me for everything else. Unfortunately, they have found out the hard way that it doesn't work that well.
Right now, it's only covering 80%, which means all of us have to pay for another insurance plan to cover the 20%. We need 100% coverage of our Medicare, and we don't need health insurance companies requiring prior authorizations for necessary medical treatments, necessary surgeries. And every day we hear about horror stories about people who were denied and delayed, and then it was too late.
We're here not just for ourselves, but for the general public, because Medicare disadvantage screws everyone. It is based on making profit. The only way they make profit is denying care. The PSC social safety net early on was skeptical of the agreement that the MLC made with the city, both in 2014 and then again in 2018, because there was no way that you could save $600 million a year, every year, without denying care. And that's the route that the MLC took and the city took. And that's why we're here, because we're urging Biden to make sure that regular Medicare is protected, real Medicare, not Medicare disadvantage, and that if we begin to claw back that $140 billion that's being wasted going into corporate executive salaries and advertising to lie to people, then we could actually go without a Medigap policy, and we could expand Medicare to cover dental, eyeglasses, hearing aids, etc., all of which is not covered now. So instead, we're flushing money down the toilet to make people in the 1% richer and richer and richer. And so we're going to keep this fight up, because it's a fight for all of us across the country. We have to have real Medicare. Thank you.